And thank you very much for joining me for this fireside chat. There has been a lot of conversation around vaccine hesitancy. And so I'm curious, how do you think about the best ways to overcome some of the vaccine mistrust?
Well, thanks for having me. I think that there are a lot of ways that we can be working to combat mistrust. And first and foremost, that's having information readily available to people that is understandable, that resonates with different populations, and is easily accessible. I think that this is really a key factor here, is that the information needs to be easy to find. If I have to spend 20 minutes trying to Google something myself to try and find the right answer, that's not well organized, accessible information. So we need to be much better at that. The second thing that we need to do is we need to be doing good research, really understanding what the problems are, where there are disconnects, and be able to address them. That's information for action. I'm running a study myself on vaccine hesitancy in a variety of different groups, and it's really helping us pick apart and understand where there are problems. The last thing that we have to do is we have to be going to the communities. We have to meet communities where they are and talk to community leaders, talk to influencers, all of the things that we know from the research that we've done in places like the Democratic Republic of the Congo, where we're constantly working with communities down to every level to really understand what are the problems, what are their questions, and answering those questions. Not the questions we want to answer, but the questions they want answered. So, Kevin, given the challenge of growing vaccine hesitancy here in the United States, how's Walgreens helping to educate communities how to vaccinate?
So one of the most important principles that we focus on is transparency. And so to your point, you really need to make sure that you have the best and most up-to-date information, because that builds trust. Not only we then take that and we leverage it across our organization, our platform. So you really need to have an omni-channel approach here. And then I'll tell you, these days we are creating content. It feels almost on a daily, if not hourly basis, based on everything that's going on. And then we're sure to put that out in different formats. So we'll do that in written form. People can find it in emails that they receive, or they can go to our website. We're doing videos. And so we're trying to really approach it from many different ways so that people get good information. Again, to your point, one of the most important things, or one of the strengths that Walgreens has, is that we're embedded in communities. And so we have highly respected pharmacists that are there in community. And people have relationships with these pharmacists. Even before the pandemic, when you wanted information, you just ask across the desk for some information. And now with the information and how complicated it can be, it's really important to lean into those people who are trusted in community. We're also working with influencers and then civic leaders. So we're able to identify those people in community who are real thought leaders, and then we're partnering with them to give them voice. So I think I'm picking up on a lot of your recommendations. Now, how do you think about really the major factors that drive into vaccine hesitancy?
We have a history of vaccine hesitancy in this country. We have the history of vaccine hesitancy globally. That many communities have experienced a lot of misinformation, a lot of disinformation over time. But historically, we've had continual disenfranchisement by medical establishments. Examples, for example, are the Tuskegee syphilis experiments or the Guatemala syphilis experiments. And it makes communities very, very hesitant. And that's why having conversations, really understanding what are their fears, what are they worried about? What can we do to work together will make a difference. I think that's the key, is really understanding from their perspective why they're concerned and what we can do to impact that. And a perfect example is having people like trusted pharmacists in their communities where they can just ask questions. I think that's going to go a long way towards addressing some of the issues right there in the community, and where questions can be answered right on the spot. So regarding the vaccine, How is Walgreens reaching underserved communities?
Well, the most important thing is that we as a senior leadership team decided that it matters and that we wanted to pay specific attention to health equity. So really from the beginning of the pandemic, and as we were setting up testing sites, we have currently about just over 2,200 testing sites across the United States, and we're on our way to 3,000. Just as a fact, more than 70% of them are in underserved, vulnerable minority communities. And we did that purposefully because we decided to follow that vision. The other thing that's important to understand, Anne, is that we're not starting from scratch here. We're leaning into infrastructure that we've been developing over the course of the last 10 years. And so we know how to put up mobile clinics. We have been doing off-site vaccine programs through the flu vaccine. So we're really leveraging a lot of our know-how, and we're doing that in community, again, with churches, civic centers, people who are really connected to make it easy. Just for context, over the course of the last 10 years, we have given out more than 1.7 million vouchers to get the flu vaccine. And so we want to do everything that we can to remove barriers and then to really lean into the infrastructure that we have. Hey, Ann, I'm going to end here. One more question for you, and that is, how do you think about this global pandemic and what will be the long-term implications that will come from this as it pertains to health equity?
Well, I really hope that what we've learned here, if this pandemic hasn't been able to drive this point home, an infection anywhere is an infection everywhere. We need to be able to take care not only of people in our immediate families, our immediate communities, but in the communities around us nationally and globally. And so we have to care about health equity, even if it doesn't seem relevant to somebody who is living in a place where they don't see issues with vaccination or see issues with vaccine hesitancy. It's very important to remember that if everybody doesn't have access to care, everybody doesn't have access, in this case, to something like vaccines or testing or PPE or any of these basic things that we need to control a pandemic, we are all going to suffer. And so I think that the message is that we're all in this together and that health equity has to be addressed. It has to be addressed from every corner. And that's how we're going to be able to get through it.
That's a great point to end on. And you've been really generous with your time. I want to thank you very much. It's been a really informative conversation.
Thanks for having me.